Hello everybody and welcome to the Thursday edition of Video Clips. And I'll remind everybody that on Monday at 9 p.m. Eastern, that's October 8th, we have a great workshop featuring a cancer patient who has been through the very difficult process of making good decisions about cancer treatment, which is often difficult to do. So I think almost everybody's affected in some way, shape, or form. Family members who've had cancer, you may have had cancer. So as always, she'll be interviewed by our expert hostess, Audrey Quick, and then everybody will have an opportunity to ask questions. So I've been covering this great book, Anatomy of an Epidemic by Robert Whittaker. We've been going disease by disease, and I almost feel funny calling these things diseases. I really don't think anxiety is a disease. That's what we talked about on Tuesday. But today we're going to talk about depression. And the condition called depression actually dates back to Hippocrates. People were talking about it and writing about it back then. And the causes of depression have been explained in all kinds of terms, ranging from possession of demons, that actually was thought to be at one point in time the cause of depression, to lack of blood flow to the brain. But the common denominator for literally centuries was that the prognosis was good. Most people just recovered on their own. The incidence of depression was actually low. In 1955, 1 in 4,435 people were depressed. And at the time that the drug market started to really take off in terms of treatment for depression, the National Institute of Mental Health actually made this statement. I find it real interesting. I'm going to read it to you. They said, depression is, on the whole, one of the psychiatric conditions with the best prognosis for eventual recovery, with or without treatment. Most depressions are self-limited. Most depressions terminate in spontaneous remissions. Well, it doesn't sound like we need much treatment for something like that, does it? Well, the general consensus of opinion at that time was since most patients got better on their own, it was really difficult to evaluate the efficacy of any treatment. However, this does not deter the drug companies. You have to give them credit for being really, really persistent about such things. So Whittaker states that the story of how drugs became the standard of care really is a testimony to how much drug companies, psychiatrists, the public, the medical profession in general, are capable of looking for magic pill formulas and ignoring the evidence that's out there. But at the time, the National Institutes of Mental Health looked at all the clinical trials for drugs and concluded that the more stringently controlled the trials were, the less efficacious the drugs seemed to be. In fact, it was hypothesized that to the extent that the drug showed any benefit at all, it had to be the placebo effect. And one problem in terms of randomized controlled trials was that the drugs had such serious side effects that there wasn't any randomization. Anybody taking these drugs actually knew they were. But a few trials were conducted where people took what was called active placebos that would induce the same side effects as the antidepressant drugs. And in those types of trials, the outcomes were identical. There was no difference between people who got the real drug versus people who got the active placebo. And so you might wonder, with a track record like that, how do we get to the place where we spend billions of dollars a year on these kinds of drugs? Now, while this was all going on in the United States, a real interesting thing was happening in Germany. And that was that German researchers were comparing antidepressant drugs to St. John's wort. And in 13 placebo-controlled trials, 55% of the patients given St. John's wort got better, while only 22% of those given placebo did. This is considerably better than the results that American researchers were showing while using antidepressant drugs and placebo. But the studies were replicated in the United States, and one might say that there might have been a little bit of bias because they're really the thing that performed best was placebo. In other words, the drugs were the St. John's wort was better than the drugs, and the placebo was better than both. But instead of reporting that, the drug companies chose to spin the information to make it look like the drugs were pretty effective. And I just want to insert for the record, I'm not an advocate of taking St. John's wort for depression any more than drugs, because I think it doesn't get to the root of the problem. So certainly don't mistake my comments for an endorsement of using St. John's wort. Now, in the meantime, studies in Europe, and this is where the really interesting research was going on. In America, they were kind of ignoring this stuff, but studies in Europe looked at the long-term effects of the drugs, and they showed that they made the people generally worse the longer they took them. Instead of suffering for a short period of time and getting better, that spontaneous remission the National Institutes of Health had talked about, patients would get better for a short time, and then they would turn into chronic, severely depressed people who had severe symptoms for a very, very long time. And the studies also showed that the relapse rate was really high in the group taking drugs. Almost all patients relapsed, and there were few cures. And again, that's a sharp contrast with the results prior to drugs, where most of the patients just got better. European researchers and doctors were the thorn in the side of the American drug companies and the psychiatric profession, which, while this was going on, waxed eloquent about the spectacular results that they were getting with these drugs, and drug sales were really exploding. While the findings of these researchers should have generated some questions, I think this statement says it all. The opposite happened. Donald Klein from Columbia University said, and this is a quote, "The industry is not interested, the National Institute of Mental Health is not interested, and the FDA is not interested. Nobody is interested." I find that hard to believe. I think some of the patients taking these drugs and having the awful side effects just might have been interested if they had been approached. Instead, the profession reframed the poor results of the drugs and claimed that depression had been misdiagnosed and misunderstood. And this is a common strategy of the psychiatric profession. And this explained the differences in recovery rates. In other words, before, those people weren't really depressed, but now that we understood depression more, we're identifying more serious people who absolutely needed to be on drugs. And of course, every time somebody tries to withdraw from these drugs, the results are awful. And to the psychiatric profession, that was documentation that people should stay on the drugs. But the research didn't support this theory either. 2/3 of patients who stayed on the drugs had recurring bouts of depression. 85% had shorter remissions, and it took less provocation to create a remission or a serious bout of depression. A research group in Texas that treated 118 patients who got not only the drugs but the best therapy available at the time showed that at the end of the year, only 6% of the patients had gotten better. Now remember the statistics I gave you earlier, that most people got better on their own before we started talking about drug treatment and offering drugs. Now, there aren't studies in the long term that compare medicated and unmedicated patients, but we do have case studies and we have data on what happened before drugs were available that we can use. So, for example, in the UK, 95 never medicated patients showed a 62% improvement in 6 months, while 53 medicated patients experienced only a 33% reduction in symptoms. And this confirmed the idea that the WHO had been saying for years that the drugs actually made people worse. US studies showed that the disability rate for those people who took the drugs was much higher, 7 times higher than people who didn't take the drugs. And if the drugs were helpful, we should expect that the opposite would be true. One researcher tracked 84 patients who relapsed but did not go back on medication, and here's what happened to them. 23% recovered in a month, 67% in 6 months, and 85% in a year. And this showed why the 6-week trials were so flawed. Not only did the drugs look better in the short term than they did in the long term, but recovery from depression without drugs takes longer than 6 weeks. So it was simply a flawed, all these trials that looked at short-term results were simply flawed by design. In conclusion, some patients suffer or experience some improvement in the short term, but they generally suffer a lot in the long term. The withdrawal symptoms are awful, and they usually motivate patients to go back on the drugs. In response, the National Institutes of Mental Health says that there are 15 million disabled people due to depression today. Not only is their depression worse than these people ever were before, but the side effects, including cognitive impairment, render them unable to function at all. And although animal models can sometimes be questionable, I think it's worth noting that studies of rats show that when rats are put on these drugs for only 4 days, they end up with twisted neurons and impaired mental function. 4 days. And we have people who take these drugs for years at a time. Now, I'll finish with this, which you should find very interesting. I mentioned before conflicts of interest, and there's no question that they affect the psychiatric business, and I do call it a business. At the American Psychiatric Association conference in 2008, a chart was used to disclose the ways in which all of the presenters were affiliated with the drug companies. I've written extensively about Joseph Biederman, the disgraced professor at Harvard who's been caught issuing fraudulent results from drug trials. He failed to disclose how much money he was getting from the drug companies to the university. But at the time he spoke, and here's what his disclosures showed. He was receiving research grants from 8 companies. He was a consultant to 9 companies and a speaker for 8 other companies. Some of the speakers at this conference had made deals with the drug companies since the conference between the time the conference began and when they spoke, and they had to actually update the charts before they took the stage. So it just gives you an idea of how rampant the conflicts of interest are with the psychiatric profession. It's just disgraceful, and I would say that most patients taking these drugs and receiving treatment don't know about it and should know about it. So I'll stop now. As always, feel free to pass these on to anybody who you think might benefit. And next week, we're going to talk about bipolar and attention deficit disorder, topics I think will be of interest to you. So have a wonderful time for the rest of your week and weekend. And by the way, don't forget our conference is coming up November 2nd through 4th here in Columbus with an all-star cast. So don't miss it. We hope to see you then. Have a great day.